Has your heart ever suddenly raced so fast that it felt like an alarm was going off inside you, without reason, without warning? Do you feel knots in your stomach, sweaty palms, and your mind trapped in endless what-if thoughts just at the idea of going into a crowd, preparing for a meeting, or remembering an exam? And do you know, when these symptoms keep returning and start blocking your studies, work, relationships, or sleep, it may not just be tension, but a sign of an anxiety disorder. The risk is real. Ignoring it can deeply affect both the body and the mind. But listen, you are not broken. Help is always possible. By the end of this video, we'll explain the symptoms of anxiety, its causes, and the most effective practical treatments you can apply in daily life, so you can start taking small, safe steps toward relief today. Hello, everyone. My name is Dr. Syeda Quadri, and I am a psychiatrist. I have been working in this field for the past 15 years. Anxiety disorders are conditions where the system of fear and worry stays activated far beyond any real danger, and for much longer. Its effects appear in both the body and the mind: racing heartbeat, shortness of breath, sweating, trembling, worst-case thoughts, and constant avoidance. Gradually, these start to affect work, studies, and relationships. According to the World Health Organization, millions of people worldwide are affected by anxiety disorders, making them one of the most common mental health problems. After the pandemic, cases and signs have especially increased among young people. Now let's look directly what the symptoms are, the common causes, and which strategies and treatments can help the most. Symptoms: body, mind, and behavior. In anxiety, the body speaks first. The heart races, breathing becomes shallow, the chest feels heavy, there's tightness in the throat, trembling in the hands and legs, sweating, stomach cramps or nausea, sudden dizziness, and waves of panic. The mind doesn't stay quiet either. Every thought turns into a worst-case scenario. The constant what-if overthinking keeps going, focus and concentration break down, sleep gets disturbed with frequent waking at night, and fatigue lingers in the morning. The behavior shows it clearly: avoiding meetings, calls, exams, or travel, repeatedly seeking reassurance, or compulsive checking. Gradually, this avoidance shrinks the circle. Work, studies, and relationships all begin to get affected. Causes: the multi-factor model. The causes of anxiety are rarely just one thing. They often work together at multiple levels. There can be a genetic tendency. If anxiety or mood disorders run in the family, the risk increases. The brain's threat circuits can also be more sensitive in some people, making even small issues feel like danger. Learned patterns, such as over-controlling or catastrophizing every situation, also fuel anxiety. Childhood experiences, bullying, loss, or constant academic and work pressure can act as triggers. Physical causes like thyroid dysfunction, iron or B12 deficiency, and lifestyle factors such as lack of sleep, late-night screen use, or excessive caffeine, nicotine, and alcohol all combine to deepen anxiety. Sometimes these triggers appear in different forms, such as social anxiety, panic, health anxiety, or generalized anxiety. But the good news is that the core principles of treatment often remain the same. Treatment: 10 practical science-backed tools. 1. Psychoeducation. When you realize that anxiety is a warning bell, not the danger itself, the fear begins to lessen. Label your triggers and symptoms and understand the body-mind connection. This is the first and most compassionate step. 2. Breath and body reset. Slow, long breaths. Inhale for 4 seconds. Exhale for 6 seconds, x 10 rounds. Send a safety signal to the nervous system. The 5-4-3-2-1 grounding method, 5 things you see, 4 you hear, becomes an instant anchor during panic. Practice this 2 to 3 times daily. 3 CBT mini-reframe. Thoughts are not always facts. Write down the trigger thought. Note the evidence for or against it. Then create a balanced line like, the danger is possible but not certain. I have a plan. Read it twice daily. 4. Exposure. Avoidance gives short-term relief but shrinks your world. Try graded exposure. Start with easy, then medium, then difficult situations. Before each step, take a deep breath and after say, I am trying. 5. Behavioral activation. Waiting to feel good first, then act is a trap. Reverse it. Do a small task now, like a 5-minute walk or making a call. Give yourself a small reward after: sunlight, tea, or your favorite song. This reactivates the dopamine loop. 6. Sleep and light hygiene. Turn off screens 90 minutes before bed. Dim the room lights. On waking, get 10 to 15 minutes of natural light and light activity. Stable 7 to 9 hours of sleep significantly lowers anxiety. 7. Food, caffeine, and alcohol. Keep a balanced plate of protein plus fat plus fiber. Avoid late evening caffeine and multiple coffee cups. Alcohol and nicotine give temporary relief but increase rebound anxiety. Write a cut-down plan. 8. Social support and scripts. Do a trusted weekly check-in. This week, my anxiety was, 10 trigger was, next step is. For difficult conversations, prepare 1 to 2 sentences in advance. It reduces nervousness. 9. Therapy first line. For mild-moderate anxiety, CBT and ACT are effective. For OCD, phobia, or panic, ERP, exposure therapy, works best. Completing small home tasks in therapy brings real progress. 10. Medication. In moderate severe cases, or when therapy alone isn't enough, psychiatrist-guided medication can help. Never self-medicate. Often, a combination of therapy plus medication works best. Always check for medical causes like thyroid imbalance, anemia, B12 deficiency, or sleep apnea. Treating the root causes reduces anxiety as well. Anxiety disorder is not weakness. It's like a train horn that sometimes blares too loud, even without reason. Correct understanding plus small repeated steps plus timely professional help. That's the real path to steady progress. You are not alone. If this was helpful, subscribe/share and comment below. Which 10-minute tool will you start today? Breath and body reset, tiny task, or morning light? This video is for educational purposes only. For personal medical advice, consult your doctor/therapist. In a crisis, immediately contact your local emergency helpline or ER.